All right, let's get right into it. As guys get older, it's pretty common to start noticing, let's just say, some new challenges in the bathroom. And that can be kind of worrying, right? You start wondering, is this just part of getting older, or is it something more? And that confusion, it usually comes down to two things that happen in the exact same spot: BPH and prostate cancer. So today, we're going to untangle all of that. We'll clear up the fear and just give you the straight facts.
And this whole conversation just got a huge push into the spotlight, didn't it? I mean, King Charles went public about his treatment for an enlarged prostate. And the reason he did it was a really powerful move, He wanted to break the stigma and basically tell men everywhere, hey, it's okay to talk about this stuff. It's important to take care of your health.
So that leads us right to the big question, the one we're here to answer. What in the world is BPH? And more importantly, how is it not cancer? Because you hear these terms thrown around, and honestly, it can get really confusing. Let's fix that.
Yeah, so when the king shared his diagnosis, it took this super common, but let's be real, super private health issue and put it on the world stage. It was a massive reminder that, hey, millions of guys go through this. And the best part, there are really good ways to treat it.
Okay, let's get down to brass tacks. We need to talk about the absolute #1 difference between these two conditions. They both affect the prostate gland, sure, but what's actually happening inside that gland is night and day. And getting this difference is honestly the first step to feeling in control.
All right, here it is, plain and simple. On one side, you've got BPH. The most important word there is benign. That means it's not cancer. It's just the prostate gland getting bigger, which honestly happens to most guys as they age. Then on the other side, you have prostate cancer. That's a malignant, uncontrolled growth of cells. Totally, completely different things.
So to really get why both of these can cause problems, you gotta look at the plumbing. See that little walnut-shaped gland? That's the prostate. And look where it is. It's wrapped right around the urethra. The best way to think about the urethra is like a garden hose. So when the prostate gets bigger, whether it's from BPH or a tumor, what does it do? It squeezes that hose. And suddenly, it's a lot harder for urine to get out.
And look, BPH is incredibly common. We're talking something like 90% of men have it by the time they're 80. But we also have to be real about prostate cancer. The number to remember is 1 in 8. About 1 in every 8 men will get that diagnosis in their lifetime. That makes it the most common cancer in American men, other than skin cancer. So yeah, it's a big deal.
Okay, so you might be thinking, if one is just a benign thing and the other is cancer, why does everyone get so mixed up? And that's a great question. The problem, and honestly the thing that causes so much anxiety, is that in the beginning, the symptoms for both can feel exactly the same.
I mean, just look at this list. A weak stream, feeling like you never quite finish, having to get up a bunch of times at night. Does any of that sound familiar? Well, those are the classic signs for both conditions. And that overlap right there is why you can't just Google your symptoms and call it a day. You absolutely have to see a doctor. It's just not something you can guess.
So that's the million-dollar question, isn't it? If the way it feels can't tell you what's wrong, then what can? Well, lucky for us, this is where modern medicine really shines. There's a clear process to figure it out.
Right. Your doctor, usually a urologist, has a whole toolkit designed to solve this very puzzle. It's not guesswork. It's a step-by-step process designed to figure out if it's just benign growth or if it's something that needs a closer look, fast.
So, what does that path look like? It usually boils down to these 3 steps. First, a simple blood test, called a PSA. Then, a physical exam. And only if those first 2 things raise a flag, a biopsy might be the next step to get a 100% certain answer. Okay, we've got to talk about the PSA test for a second, because man, is it misunderstood. PSA is a protein that's made by all prostate cells. Healthy ones, big ones, and cancerous ones. So of course, if your prostate is bigger because of BPH, your PSA level can go up. Here's what you have to remember. A high PSA is a yellow flag, not a red one. It just tells your doctor, hey, we should probably take a closer look here.
Okay, so let's say a biopsy does find cancer. This is when a chart like this becomes your roadmap. A pathologist gives it a grade. You might hear it called a Gleason score or an ISUP grade. This isn't just some random number. It's a way of measuring how aggressive the cancer looks. A low score, that usually means it's slow growing. A high score, that signals something more serious. And this score, more than anything else, is what helps decide what to do next.
So once you have that clear diagnosis, you know for sure if it's BPH or prostate cancer. The treatment paths split off in completely different directions. I mean, the goals are different, the procedures are different, the side effects, everything changes.
With BPH, it's all about one thing: making you feel better, getting rid of those annoying symptoms. It usually starts simple, with medications that just help relax the prostate muscles. If that doesn't do the trick, there are cool, minimally invasive things like Resume, which uses steam to shrink the tissue. And for the really tough cases, there are surgeries like a TURP that actually go in and remove the extra tissue that's causing the blockage.
But, with any medical procedure, there are always trade-offs, right? A really common side effect with BPH treatments is something called retrograde ejaculation. It's where semen goes into the bladder instead of out during an orgasm. And if you look at this chart, you can see the risk is all over the place. It's pretty low with a procedure like Resume, but it gets much, much higher with the bigger surgeries.
Now, switching gears to prostate cancer that's still contained, the goal here is to cure it. But here's something you might not know. Jumping straight to treatment isn't always the answer. For slow-growing, low-risk cancers, a lot of men choose something called active surveillance. Basically, you watch it closely with regular tests. For more aggressive cancers, though, the main options are usually surgery to take the whole prostate out or radiation to kill the cancer cells right where they are.
And when you talk about treating prostate cancer, the conversation almost always lands on two huge quality-of-life issues. What's the impact going to be on urinary control, and what's the impact on sexual function? These are obviously super personal topics, and the good news is that doctors have gotten way, way better at minimizing these risks.
So let's talk specifics on the sexual function side. With the latest nerve-sparing surgery, studies show that about half, 50% of men who had good erections before surgery will get back to that long term. Now, of course, that number can swing up or down depending on your age, your health, and the details of your cancer.
So we've covered a lot of ground. What's the big takeaway from all this? It's pretty simple, actually. Knowledge is power. When you understand what's going on, the fear starts to fade and you feel empowered. You can ask the right questions and you can make smart decisions for yourself.
Here's the bottom line. Whether a doctor tells you it's BPH or prostate cancer, neither one is a dead end. Not even close. These are both conditions that modern medicine understands really well, and there are clear, effective ways to manage them. There's always a path forward.
And that leads me to the last and maybe the most important point of all. This isn't something you're supposed to figure out on your own. It's like the quote says, the best results happen when you and your doctors are a team. You talk about all the options, and together, you decide on the path that's right for your health and for your life.
Look, thanks to people like King Charles and just a general shift in awareness, that old stigma around men's health, it's finally starting to crack. The conversation is happening out in the open. So the real question for you isn't if you should ignore symptoms, you shouldn't. The real question is, are you ready to be a part of this conversation? To take that first step, talk to a doctor, and really take charge of your own health?